Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal the truth on common myths about sex. But first, let's take on some viewer questions.
Excellent. Here we go, Dr. Leah. Question number one. A man says, ever since I've been on blood pressure medications, I've had erectile dysfunction issues. What can I do?
That's not surprising. Erectile dysfunction, or ED, is an occasional side effect of many blood pressure medications. Drugs like beta blockers and diuretics can decrease the blood flow to the penis and make it difficult to get an erection. Other blood pressure drugs such as alpha blockers, ACE inhibitors, and angiotensin receptors rarely cause ED. Some can even facilitate erections. There is some research that suggests that the effect of blood pressure meds may be more psychological instead of physical.
Okay, so what can they do about it?
If your ED issues started shortly after you began taking blood pressure medications, ask your doctor about switching to another type. Remember that it can take anywhere from several days to several weeks after stopping blood pressure medications for erections to return. You could also try a drug like Viagra or Cialis, which are usually safe to be taken with blood pressure medications. But before you do, check with your doctor because some blood pressure meds can cause serious complications with ED drugs.
That's right. Good advice, Dr. Leah. Always check with your doctor before changing anything in your medications.
Absolutely. Or combining any other medications
There you
there.
go. Right, exactly right. Good advice. Our second question, Dr. Leah. A viewer says, my wife and I have always wanted to try role playing, but don't know where to start. Any tips?
Well, role playing can be a good way to change up your sex life because it gives you the opportunity to explore different characters while having sex. A role playing scenario can be complex or simple, and depending on what you decide to do, it could involve dressing up, a fantasy location, or even a scene from your favorite movie or book.
Okay, I'm not going to assume that you do this, but how should they get started? You know.
Well, a good way to start.
Well, maybe you do. That's not a bad thing.
A good way to start is by brainstorming your sexual fantasies and the roles you want to play, right? Discuss what you both think would be a stimulating sex scene or an erotic and fun situation. Make a list. You can put like yes, no, or maybe after each suggestion. Then, very important, set some ground rules about what acts you would consent to and if there's any that you absolutely know you wouldn't. Definitely pick a safe word so that if you say that word, you know you want to end the scenario. When role playing, make sure to communicate. Tell your partner when you're enjoying it or not enjoying the scenario. Since you're both role playing and not acting like yourself, it may be difficult for her to tell if you're having fun. Afterwards, you always want to discuss the experience and share what you liked and disliked and what you'd like to do next time.
A man says, I was looking into penis enlargement surgery, but can't tell if it's worth it. What do you think?
Well, penis enlargement surgery is done to make your penis appear bigger. Some of the procedures you see are surgeries to make your penis look longer. Surgery to increase the girth of your penis and liposuction to make your stomach look smaller are all ways that you can make your penis look larger. There are also medical reasons to consider enlargement surgery, such as having a micropenis, a very small penis, or a buried penis, which is the penis that's hidden under your skin from your stomach, thighs, or scrotum.
Okay, and on that same note, what options do men have, for example?
Well, so you've got cosmetic fillers, which can be injected under the skin of the penis. However, some fillers are safer than others. Hyaluronic acid, just so you know, can be reversed if the doctor makes a mistake. So you could inject another serum in there and reverse it. Not that the doctor would, but just in case. So that could be one.
And you know, these fillers that you just mentioned, are they the same ones that people put in there for the wrinkles and things like that, or is that a different
Hyaluronic fillers are, right? So you can put it to contour the face or whatever the people are doing there. So yeah, that would be the same ones. I don't know if they're using fillers that are non-hyaluronic. Like, I don't know if they're specifically penis fillers. I've only heard of hyaluronic fillers, which are usually helping with girth in that case.
Okay.
Yeah.
Okay, so any other options?
There is a Penema device where the silicone is implanted under the skin of your penis and stretches the skin and the tissues to make the penis larger. This is a procedure that is FDA approved and it costs about $15,000. There's another surgery where a surgeon cuts the ligament that connects your penis to your pubic bone, making the flaccid penis look longer by cutting the suspensory ligament that can cause an erect penis, but it can cause an erect penis to be unstable. This lack of support during an erection could actually result in injury to the penis during sexual activity. So with any of these surgeries, there are obviously risks involved, including scarring, loss of sensation, or pain in your penis, and erectile dysfunction. So only you can decide if penis enlargement surgery is worth it. You definitely want to talk to your doctor to see if you're eligible for the procedure.